We have seen over the last 1 week an increase in the number of kids coming with asthma flare-up and other kind of difficulty in breathing, starting as a common cold, cough, sneezing, sore throat. So we started to see those respiratory infections again. We used to see them a lot before the COVID, but nowadays, because of everybody back to school, big social gathering, restriction about masking and hand hygiene and isolation have been lifted, we saw an uptake in the number of cases. From common cold to the influenza virus to RSV virus to COVID. So definitely over the last 1 week we have seen a lot of kids coming sick to the hospital. Many of them have underlying health issues that make them sicker, asthma especially. But definitely it's a trend we are monitoring and we have been worried about.
I feel like, as a parent or, a lot of parents, your kids get sick, right away you're going to do the COVID test because that's what we do. And if it's negative, you're like, oh, I guess they're good. Is that the case? Or
I mean, that's a good practice, but nowadays COVID for many kids can look like flu or common cold. For young babies, RSV virus will act like that. So, and also depends on what home testing you have. Many of those home testing are good, but they're not very sensitive. So your kid can still have the COVID or the flu. If they're coughing, sneezing, acting sick, you better double check with your either physician or keep them home, instead of sending them to school, because those tests are not 100%. So I won't worry just about COVID. We have seen increased number of cases with respiratory syncytial virus or RSV. We have seen increased cases of the flu. So all of this are capable of making kids sick, like if they have COVID. So I will check with my doctor.
Do most of those things, like if you have the flu or if you have RSV, are they things that just have to run their course, or they need medicine, or?
Good question. So many of these respiratory viruses, like the common cold, they have to run their course. But for things like the influenza virus, we know we have medication that we can give it, and the earlier the better. If your child got the medicine in the first 2 days, there is a better chance of that medicine shortening the duration of the illness and making the fever go away quicker. The same thing for COVID, especially for kids who have underlying health issues. There is some intervention we can do for those kids. There is some pills that they can take, especially for kids 12 years and older. There are also some monoclonal antibodies and IV medication that we give it for the kids who have the highest risk. Somebody with asthma, chronic lung disease, heart disease, diabetes. Definitely, if my child got any of these medical problems and caught COVID or flu, there's something we can do about it to make sure that those illnesses don't get severe and help them recover quicker. So I won't just sit on it and say this will run its course. There's some treatment we can do for those infections.
It seems like before COVID, fever was like the barometer. If you had a fever, you stay home from school or quarantine or whatever. Is that still the case?
That's still true, yes. For most of those respiratory infections, they are typically associated with fevers, especially, COVID and the influenza. Typically, if you saw the fever, that could be sometimes even the first sign. The runny nose, sore throat will peak the next day. So fever, stay home. Fever, child acting sick, need to be seen by the doctor. Next day, you probably most of the time will see those other symptoms coming. Now, especially those young babies, young infants, they could have a serious respiratory infection and not necessarily have a fever. They could have just a bad cough, bad runny nose, not feeding well, throw up after feed. Those, if they have these kind of respiratory symptoms, even without a fever, I'll be careful with those young babies. And I'll check with their doctor, because they can have, for example, a respiratory infection with RSV virus that can make them sick and go down to their lungs and cause what we call it bronchiolitis, which is an inflammation of the small windpipes inside their lungs, get filled with mucus, they have trouble breathing. And many of those kids, especially the premature one, won't develop a fever. You'll see the baby sick, struggling with feed. That's the time you to call your doctor.
So if I have a healthy 10-year-old and they seem like they're coughing and having, some chest issues or whatever, you're saying look to see what other stuff is there if they're not eating.
Correct. Yes, I will look at how much they're eating, drinking. If you give them a dose of Tylenol, 2 hours later, are they up and playing? Then I will watch. I'll let it run its course. But if my child is acting sick, having trouble breathing, you could see their chest is rising up and down, or they're not feeling good, they're not eating or drinking, or if they have some of these underlying health issues, I'll check with their doctor. If somebody has diabetes, and they start to have cough and runny nose, they might look okay, but I'll give a call to my endocrinologist because maybe their insulin doses need to be adjusted, or maybe they need to be given that flu medicine early on to prevent them from getting sick and reach the hospital.
Is there something I didn't ask you that you think's relevant that you wanted to get across?
Yeah, I mean, the other thing, I want to emphasize the importance of still using common sense precautions. Continue to teach kids to wash their hands before and after they eat, at lunch break at school, using coughing etiquette, sneezing etiquette, to sneeze in their armpit, keep a distance. Always, if your child, you have any gut feeling that seem to be sick or off today, keep them home, Don't go to school and risk other kids maybe sometimes getting infected. I want to remind also, many of these illnesses, especially the flu and the COVID, we have vaccine that can prevent illness, can prevent severe illness. So your child might still catch the flu or might catch COVID, but they won't get severely ill to be in the hospital. The other advantage I want to emphasize with this kind of vaccine, that they prevent the child from bringing flu home. So actually it protects the other maybe susceptible individual in the house. If you have an old grandma in the house who on chemotherapy, you don't want to bring flu home. So the child will be protected, and that kind of protect the household from having a flu circulating in the household. So that's another advantage of vaccinating your young kids, because we know from studies and literature that these kids are the first to bring those respiratory infection home, probably from school. So I will definitely ask your doctor about the vaccine for the influenza and COVID vaccine. It's approved now for 6 months and older.